the Raphael Rogers Golden Age Fellowship UC Berkeley, and the silver medal for the highest GPA at Aerospace Engineering, IIT Madras 2003, to name a few. He has authored and co-authored more than 150 publications in leading peer-reviewed journals and conferences, and has more than 12 granted patents in India, US, and Europe. Ayur AI has also received several accolades for this pioneering work in Ayurveda, including the first prize in the Ayur Startup Grand Challenge. His goal is to create global deep tech companies in integrative medicine and diagnostics. Welcome, Dr. Bala Pesala, and I invite him to come on the stage and deliver his talk, the first opening talk of the day. Welcome, sir.
Good morning, everyone. Thanks, madam, for the kind introduction. Respected Kotecha sir, who has been a great inspiration for an engineer to transform into the field of Ayurveda, and all the dignitaries here. It's my great pleasure to be here today. I am not an expert in Ayurveda. I'm, in fact, a student in Ayurveda, and I look forward to learning from all of you. So today, the world is changing. Any science is dynamic, so with Ayurveda. And the beauty of Ayurveda is, over the centuries, Ayurveda has assimilated a lot of concepts and new age technologies. So as you know, today we are at the cusp of digital age. All of us carry one or more few digital devices. And the potential that we see is Ayurveda can leverage all the digital advances and incorporate to make Ayurveda scale globally. So I'm going to talk about Ayurveda 3.0. It's the next generation of Ayurveda, which encompasses digital markers and the emerging multi-omic markers for personalized and preventive health. So what is Ayurveda 3.0? So as you know, traditionally Ayurveda has been practiced for centuries with particular frameworks. That's Ayurveda 2.0 is where Ayurveda doctors started leveraging the blood markers. In fact, a lot of Ayurveda doctors look at the blood reports, can interpret them, and improve their diagnosis and recommendations. So what will happen in future is Ayurveda 3.0. So it's a convergence of all Ayurveda with the new age technologies, in particular, the digital markers that we all get from digital devices, the multi-omic markers, and once we have this complex information, we will have an AI that needs to assimilate all this information and deliver personalized and preventive wellness. So, whenever I give a talk, the question that happens is that comes up with is, what is the secret to living longer? So this is a person from France documented. There could be rishis in olden ages who have lived longer, but the longest lived person documented is lived for 122 years. So what is the secret? So people may think that good genes is the secret to longevity. In fact, genes only contribute 15%. The rest, what we call is epigenetics. It's beyond the genes. And that's where the biggest potential of Ayurveda lies, because these are alterable. These are alterable through highly personalized approaches that Ayurveda has described in the text. It's about Dinacharya, Ritucharya, Panchakarma, all these procedures. So if you follow the Ayurveda principles, there is no doubt that we can improve healthy longevity. So the integrative approach has the biggest potential. In fact, the studies done in US show that if you can keep people healthy for 1 year, just one single year, we can save $38 trillion in healthcare costs. And the idea behind this is we take all modern markers, digital markers, multi-omic markers, but leverage the beauty of Ayurveda, which is a 2,000-plus-year-old system, and when layer these two markers, you can have holistic medicine. So as I mentioned earlier, the beauty of Ayurveda is understanding health very well. In modern science, typically absence of disease is understood as health, but Ayurveda describes among healthy individuals, there are different phenotypes we call Prakriti. And you can have a personalized diagnostics to ensure that they remain in their Prakriti state. Once you identify the imbalances, then you can bring them back to their Prakriti using a combination of diet, herbal products, yoga, meditation, etc. So AI can play a significant role in both the diagnostics part and the recommendation part. So when we talk about diagnostics, I consider any Ayurveda doctor or even a modern doctor as an extremely good statistician. So they're in fact AI engineers for centuries. Because if you look at what makes a good diagnostician, basically you have to understand the root causes of the diseases and give personalized interventions. So I've layered all the Ayurveda terms on top of what is known as a good doctor, statistician in modern science. The challenge with any practice, doctor's practice, is the doctors need to see a lot of clinical patients to make good decisions. There could be bias, there could be limited time, etc., etc. And this is where AI can play a very significant role, because machine and deep learning algorithms can be trained to have minimal bias. And you will not only do that, we can also give suggestive recommendations. So I consider AI as not a replacement to the doctor, it's augmented intelligence. How we can make every doctor the best doctor. So as all of you know, most of the studies that we have done identifying Prakriti, etc., are done on extreme Prakriti phenotypes. There is always a challenge when you have to assess the Prakriti of an individual in real setting, because most of us are mixed Prakriti. So when we looked at the, this is the problem that we looked at the center funded by Ministry of Ayush at IIT Jodhpur. We called 7 Ayurveda doctors and asked them, that is Professor Brahmachari, former Director General of CSIR, who was our advisor. We asked the doctors, you please assess Prakriti of Sir. You can ask any questions. Undoubtedly, 7 doctors came up with 7 slightly different answers. Right? So if Prakriti is so basic in Ayurveda and we have to reach a consensus in terms of what is the Prakriti, then we need to have better standardization and frameworks and structures. And Ministry of Ayush has done an excellent initiative about Prakriti Parikshan using a standardized questionnaire and machine learning. I think this is an extremely good step in the right direction. So the way we look at Prakriti is, typically it is looked at as a classification problem. How do you classify an individual into 7 different Prakritis? But for this, you require a lot of training. So what we look at is, we look at reformulating the Prakriti estimation as a regression problem. So then you only have 3 variables. You just have to predict Vata, Pitta, Kapha percentages. So essentially, you have reduced your data set significantly. And in mixed Prakriti determination, you can leverage the machine learning and deep learning techniques. So in fact, there is a study that we have done at SRM University, which looked at 500 patients, and we have used this regression-based analysis to understand what is the Prakriti. Not only that, we can also explain what are the features that contribute to the Prakriti. So if you are interested more in understanding estimation of Prakriti using machine learning and how do we explain what are the features, you can look at my colleague Dr. Pratibhan's talk, which is coming up in the conference, how machine learning techniques can be used to determine Prakriti accurately. So next point is, how do we determine the Vikriti? So we have, I think a lot of you are familiar with these digital devices. And the way I look at it is both Ayurveda parameters and the markers that you get from these digital devices, they're in fact same representations of your physiological state. So you can actually go back and map each of these parameters with Ayurveda parameters. High temperature could be Pitta. Low heart rate could be Vata. Right? High respiration rate, BP, etc. could be Vata. So the important thing is, right, the physiology is the same, and Ayurveda describes this physiology in certain language and modern science in a slightly different language. The biggest challenge is when we look at any of the digital markers, the static markers don't provide enough complex nature. So one study that we had done Dr. Pratibhan was one of the lead authors with CSR IGIB, shows that if you actually look at digital markers, at rest, they don't have a lot of information to distinguish the Prakriti. But when you actually perturb the physiological state, in this case an orthostatic stress, we asked the patients to tilt, is the dynamic responses that has more information on the Prakriti. For example, we showed that even though static markers don't differ, when you actually tilt a patient because of the orthostatic stress, the dynamic markers, the change in the heart rate and the heart rate variability, that has much more information and correlation with the Prakriti. So my point is, we are in the age of digital devices. You have so many markers and we can measure them real time. So you can look at heart rate variability, respiration rate, ECG, all these markers in an Ayurveda perspective and see how these markers change and correlate with the Ayurveda parameters, Vata, Pitta, Kapha, etc. So moving beyond, right, it's not just the static markers. There's a lot of dynamic markers. Once we get these digital waveforms, you can in fact create new markers. So just to give you an example, if you look at the pulse diagnosis that is done for age-old centuries is actually deriving new digital biomarkers from the pulse waveforms. In fact, in the modern science, we hardly touch the pulse. We just look at the heart rate and heart rate variability at max. But the pulse has so much complex information. And as you know, the basic understanding of pulse diagnosis is, since cardiovascular system is a closed loop system, every point in the pulse has information about everything else. And when we do the full system modeling, we can potentially understand and explain the pulse diagnosis, the reasoning. So AI, in the meantime, AI can be used to map the pulse changes and correlate with the digital markers. So let me show you a quick example, right? So all of us have smartphones and we can actually collect the blood pulse from the smartphones. And if you leverage the deep convolution network, sort of the algorithms that you typically use in your phones for detecting the face, etc., you can in fact estimate the Vikriti with the percentages. Right? So we have done this, the next paper is coming out, how we can leverage the deep convolution networks to estimate the Vikriti, but the important thing is the correlation between the modern markers and Ayurveda markers. There's a quick video that can be played to show you how just a fingertip pulse has so much complex information, and that complex information can be extracted from the new age digital markers and AI and correlate with Ayurveda parameters, whether it is Bala, Vega, Gati, so we call it heart rate variability, etc. Right? So you can see that just from your finger pulse, right, and the blood pulsations, you can extract these waveforms. And according to me, an Ayurveda doctor is a highly trained statistician to look at that small changes in the pulse that happens. And that's why you need a lot of training. And with the AI and machine learning, these changes can be understood. But I want to warn you, pulse by itself cannot tell everything because there are a lot of confounding factors, whether it is adiposity, age, gender, short-term influence, etc. Okay? So I've been given to sum up in the next 2 minutes. So that's why you need to leverage all other parameters, whether it's symptoms, Ashtaveda Pariksha, Dashaveda Pariksha, and these have to be combined with the pulse to extract the right information. Just a couple of, I'll just take 2 minutes. So there is a lot of blood markers that we get, right? And you can actually correlate the blood marker changes with the Ayurveda parameters. What blood markers increase or decrease when Vata increases. Same thing, what microbiome changes when you have Vata or Pitta increase or decrease. Right? There is a lot of science that needs to be discovered, and you can link the modern gut microbiome markers with the Ayurveda markers. So this I will skip. I just want to tell that Ayurveda emphasizes a lot on preventive health. So we are also looking at how to diagnose things at an early stage and have a comprehensive platform. This is a paper that will be presented as a part of this conference. The recent Lancet study shows that there are 130 million people in India with pre-diabetes. And there is no way to screen them unless you do a blood test because you don't have a lot of symptoms. So this is the work that we have done with Dr. Supriya, which shows that this paper will be presented as a part of this conference, which shows that if you actually combine Ayurveda markers with the digital markers, you can find novel pre-diabetic clusters, and each of this cluster has Vata, Pitta, dominance, etc. And you can also predict the pre-diabetes without a blood test. Right? So these initial results, that a lot more work needs to be done. I will end my talk with the last development. In fact, I remember walking into Secretary Sir's office 3 years back, and he said that why can't we have digital devices, like a digital kiosk, which can give a first level of estimation of both Ayurveda, Prakriti and Vikriti. So we started looking into this problem, and I'm happy to say that we started integrating a lot of the digital devices with the kiosk, and our first deployment happened with the support of IEEE USA in Biloda village, Gujarat. So there is a quick video to show how this kiosk is actually helping screening of people in the village so that their early disorders can be understood. Can you please play the video? And they can also talk to an Ayurveda doctor, because as you know, a lot of primary health care, we don't have good access to doctors. So here the idea is that once you integrate Ayurveda framework into the kiosk, the patients will be able to get a lot of digital parameters. So this is integrating both Ayurveda and digital markers into the kiosk. And you can integrate the blood pressure, you can integrate the ECG. We have also integrated something called a body composition analysis, because that can give you a very good indication of how your fat is distributed all over the body, and if you have a lot of visceral fat, that can potentially contribute to diabetes. So these are the frameworks that we are developing to ensure that even people at the last mile can have access to good Ayurveda doctor, and the Ayurveda doctor can also look at the digital markers collected from all these devices. They can do the Prakriti assessment, Vikriti assessment, and they should be able to understand their health much better and do interventions. Yeah, next. So I'll just end my talk. To say that such digital devices has huge potential in revolutionizing healthcare. So we have, as you can see, we have a lot of health and wellness centers that are planned, and this kiosk can play a significant role. And once we have a lot of data, we can actually use AI to give preventive recommendations. There's a lot of opportunities in digital physiomics, digital Ayur twins. So you can have a digital replica of yourself, including all the Ayurveda markers, and also linking Ayurveda markers with the chronobiology as described in Ayurveda. And I will end this talk to say that the future looks bright and the future looks integrated, and I'm happy to interact with you more to learn how we can best integrate Ayurveda and modern markers to scale Ayurveda globally. Thank you.